time it's her time to speak, we can she'll be able to join us. So I just want to say good evening, everyone. Thank you all for joining us today. My name is John Murphy. I am the project coordinator for Behavioral Health Network. I would like to welcome you all to this first episode in this webinar series. It is our series that will focus on a collaborative approach to identifying and engaging youth that misuse substances. This webinar series was put together by Behavioral Health Network and Preferred Family Healthcare staff and is designed to be informational and create dialogue surrounding next steps around community collaboration. Though our goal, or our focus audience, are professional providers that work with youth and families, we welcome any community member that's interested in learning more about this specific subject. So a little bit of housekeeping just to make sure things run relatively smoothly. If you do have any questions, we will have those answered at the very end of the webinar, just so we make sure to keep time and make sure that we get out of here right on time. So please utilize the chat feature, or you can shoot me an email at jmurphy@bhnstl.org. Or if you're watching from Facebook Live, you can also send a comment or post a comment on this live screening, and another of our coworkers, the wonderful Melissa Benson, will be watching the Facebook Live feature, so we can make sure that those questions get answered at the end of the webinar. So if you did want to, or you weren't, if you're somebody that has to leave a little bit early, these slides and this presentation is being recorded, so it'll be able to be distributed later to all attendees. And I have all of your emails, but if you're somebody that is watching through Facebook Live or another means and you didn't register for this event, feel free to shoot me an email, again at jmurphy@bhnstl.org, and I'd be happy to make sure that you get all this information that'll be covered tonight. So I just wanted to start a little bit about what led to this webinar series and why we are doing this. So at first I did want to just describe a little bit about my position and what I'm coming from as your facilitator. I thought it'd be good to just kind of describe that a bit. So I specifically, my name is John Murphy. I work for Behavioral Health Network of Greater St. Louis. I'm a project coordinator for a grant called TREE, which is all about looking at how medical offices and institutions look at, identify, and engage youth substance use. And a lot of what I do is to figure out how to decrease barriers for early identification, intervention, and referring to the TREE project through Preferred Family Healthcare. Now, with all of that keeping in mind, when creating this webinar series, what I wanted to do was really just start from the basics. So when I was speaking with various organizations and community partners, it seemed that there were a few themes surrounding youth substance misuse. For one, partners that work with youth and families all agree that it is something that needs more attention, especially with a medical office framework. Number two, COVID, as we know, has impacted outreach and engagement efforts surrounding how behavioral health services are conducted, not just with, of course, substance use, but with all avenues and all aspects of behavioral health care, and even other physical health as well. And so really looking at, well, how can we more correctively and more collaboratively approach how COVID has impacted outreaching and engaging specifically youth in this instance, but other hard to reach populations as well. And then another theme came out of lack of knowledge around early intervention and engagement surrounding youth substance misuse and knowing where to refer. So kind of with all those in mind, this led me to believe that the Greater St. Louis area may need to look at youth substance use through both a collaboration with others that are doing similar work, but also figuring out how those that work with youth and families may have intersecting needs, such as, should we as a region start focusing towards substance use prevention as a means to decrease community violence? Can substance use screening be integrated with other routine topics that youth get checked for during child visits or routine doctor's appointments? So really all of that led to the hope that we can have this dialogue and really start this conversation. And what I thought was we needed to have some kind of webinar or some kind of mutual conversation where we talk about a need for collaboration. We talk about, again, how COVID has changed the landscape, and then discuss a desire for innovation and strategy surrounding youth substance misuse. So tonight, we will be talking about an overview of the youth substance use landscape in the Greater St. Louis region, but we do have 3 other episodes that we will be talking, that I will provide you the information for right now, but they will be the same time for the next 3 weeks. or next 4 weeks. So tonight, again, is a general overview of the landscape of youth substance misuse, but we will be talking about some other great topics too. So a week from tonight, we'll be discussing integrating substance use screenings into hospitals and primary healthcare settings. We will be the week after that, linking substance use and violence with data, trends, and current efforts for prevention. And then the final episode will be describing youth families in a virtual environment. So how to leverage technology around behavioral healthcare access. So this series is also set up both overall, but also within each episode to attempt at a larger level observations and trends going down to individual and on the ground work. So the hope is that after tonight, or with tonight, we really set the stage for a general overview. And then through the structure of tonight, we will be having a kind of top-down approach. We will be hearing from some individuals that do more data analysis and epidemiological surveys and studies surrounding behavioral healthcare within the greater St. Louis area. We will then head into an individual that specifically does research around the Missouri Student Survey and looking at some results from the 2020 survey around youth substance use interpretation and understandings. And then we will have somebody that will be specifically talking more on the ground work and some observations that she's witnessed through youth substance use through her work at Preferred Family Healthcare. But with our other episodes, really, again, we want to set the stage tonight, and then through the next few episodes, really think about other avenues that substance use intersects. Also wanted to highlight that we have some really great individuals from awesome organizations that will be speaking. This is just a list of all of them. And I also did want to mention that, of course, this doesn't represent everybody within the greater St. Louis region that could possibly benefit from, or us benefit from hearing about their perspectives. But I just wanted to highlight that we do have all these amazing organizations, and in the future, we would be happy to conduct other webinar episodes that do feature other voices that aren't currently involved in this webinar series. The last thing I did want to touch on is what are prospective outcomes from this series. So as I mentioned earlier, we do hope to have, this really creating the dialogue initially, but what do we hope to come out of this episode, right? Or this entire series. And so one thing that we want to do is really think about substance use as a preventative approach. So how can we shift youth substance use to conversations that include a preventative approach, such as maybe looking at violence within a community and really identifying that, well, this community has a lot of substance use needs. Maybe treating the substance use could really be treating community violence from happening. So really looking at as a preventative approach to other possible violence or other kind of avenues as well. We also want to look at systemic changes. We want to begin the initial conversation surrounding a need for systemic changes, but also how we can collaborate. So new collaborations as the next one with the various community partners and bringing them to the table to really think about the intersection of substance use and their work with youth and families. We want to create action-oriented steps as well. So obviously creating realistic steps that have action-oriented steps within those to really think about coordination and really think about, well, what can we do concretely to move this conversation along? And then lastly, we want to understand how COVID is impacting this entire landscape of behavioral healthcare within the greater St. Louis region. So we want to understand how substance use treatment and other youth-oriented programming will be impacted moving forward with COVID, even though who knows, hopefully within the next few months, rates will be going down, but if they don't, and even if they do go down, our landscape is continuously changed from now on. And so really thinking about how we can work collaboratively within this new landscape. So to provide just an overview with the specific individuals you'll be hearing from tonight, as I mentioned, I'm John Murphy with Behavioral Health Network of Greater St. Louis. Our first speaker will be Neha Sastry, who is an epidemiologist or behavioral health epidemiologist with the City of St. Louis Department of Health. She will be speaking about substance use trends within the St. Louis city. We will also have Susan Depue, who will be speaking about substance use trends all around the eastern region of Missouri from her Missouri Students Survey. And then we will have Shayna Parker, who is a family coordinator with the TREE Project from Preferred Family Healthcare, and she will be speaking about her experiences working with various individuals in this specific landscape of youth substance use. So I did want to introduce Neha, and I do want to make sure that Neha is present because she may have had a meeting that went a little long. Neha, are you on the call?
Yep.
You are, awesome. I'm so happy to see you. All right, so to give a great brief introduction to Neha, she is originally from Baltimore, Maryland, and she graduated from the University of Maryland, College Park, with a degree in public health science. After learning about HIV and AIDS, the HIV/AIDS epidemic, she was inspired by the work of the CDC and the epidemiologist there to become an epidemiologist herself and pursue her Master of Public Health in Epidemiology and Biostatistics at Washington University in St. Louis. Through the Washington University's MPH program within the School of Social Work, it really showed her the true interdisciplinary nature of public health and the imperative of an epidemiologist's dedication to social equity and justice. As a behavioral health epidemiologist with the Department of Health, she's dedicated to advocating for vulnerable and minority populations using data and community needs to drive community-based programs with help of community partners. And so with that, I would like to hand it over to Neha. I will stop my sharing and I will let you over.
Okay, hello everybody. My name is Neha Sastry. I am, as I said, as John introduced me as, I am the City of St. Louis Department of Health behavioral health epidemiologist. So I'm going to be talking a little bit about substance use, morbidity, and mortality in the city relevant to youth populations. Let's see if we can get this going. Why isn't it? Oh goodness. There we go. Okay, sorry, that took a second. Okay, so we're first going to be looking at some crude fatality rates by age group. Some of the trends that we've noted, that I noticed in those below the age of 30 mirror that of the city overall, where in the overdose counts you see a sharp increase from 2016 compared to 2014. In 2014, the crude death rate was 766, while in 2016 it jumped up to 1,300. And that's pretty consistent with what we've seen in the city overall, where there was a 35% increase in overdose fatalities from 2014 to 2016. And then when we compare those, one second, sorry. Okay. And then when we compare, not when compared overdoses among those below the age of 29 to the total count of overdose fatalities. The rate among those 0 to 29 has decreased in the last few years, despite the counts of all overdose fatalities increasing. So this is kind of good news, but we'll have to see how trends go on further. As I'll talk about later, 2020, COVID-19 has definitely posed some unique challenges to those struggling with substance use disorders, and youth is no exception. And this graph looks specifically at overdose fatalities by age group from those below the age of 10, those ages 10 to 19, and those ages 20 to 29. While there is an increase in overdose fatalities among those 20 to 29, from the years 2014 to 2018, 2019 doesn't necessarily reflect that trend. From 2018 to 2019, there was a 48% decrease in overdose fatalities among those ages 20 to 29. Now, this could be good news, but from 2018 to 2019, there was a dramatic increase in overdose fatalities among those ages 10 to 19 by 2,200% from a count of less than 5 to 23. So there's a few ways we could interpret this. We could interpret this as more 20, 29-year-olds seeking help for their substance use, but this comes hand in hand with the likelihood that there's an increase in individuals between the ages of 10 to 19 using substances. Something that's also been noted in trends examined from all overdose fatalities is that fentanyl has increased dramatically over the last 5 years. Overdoses specific to fentanyl has increased by 47% from 2018 alone. So it could be that more substances are being cut with fentanyl, and that's why there's more overdose fatalities due to fentanyl. And these trends also reflect the possibility that there's an increase in substance potency among those who are using substance, including those ages 10 to 19. When we look at them by age group, the two figures represent a comparison between 2019 to 2020. As you can see, there's been an increase among almost every single age group, and this is likely due because a lot of people are not able to get access to the resources that they need or are referring to substances to cope with the prolonged period of self-isolation. As we work with our community partners, it's becoming increasingly apparent that we need to upgrade our resources to kind of cope with the pandemic rather than waiting for the pandemic to be over. This is in the two graphs below, you'll see that between the ages of 20 to 29 have increased by 22%, almost 23%. And then those below the age of 10, did increase by 1, but at the same time, given that the year is not over yet, this is still cause for concern, in my opinion. And then when we separate, and this figure might be a lot to look at, but when we separate age group by sex, we know that there are more cases among men than women. Men, on average, make up 71% of our overdose fatalities here in the city. And while those trends are kind of shifting, the percentage of men overdosing is decreasing, while the percentage of women overdosing is increasing. From 2014 to 2016, there were 2 to 3 times more overdoses among men than women. And as I said, this changed 2017 onwards, where overdoses among women are increasing, and that's across all age groups. So while we know that men are less likely to seek care for their mental health issues, it's becoming apparent that women are also suffering from mental health that's leading them to overdose due to substances as well. So these are just some things to keep in mind. These are obviously overdose fatalities numbers, but they reflect other trends that we see in terms of other mental health indicators, such as suicidal ideation, suicide attempts, where men are more likely to have higher counts of suicide compared to women. So then when we calculate the fatality risk ratios by age group, we see that from 2014 to 2019, those ages 0 to 29 have a greater fatality risk secondary to substance overdose compared to those above the age of 30. And the figure below represents the risk ratio of each year since 2014, the figure on your right. And while it is decreasing, it's still quite high. So in 2019, those ages 10 to 29 had a 168% increase in fatality risk, secondary to a substance overdose compared to those above the age of 30. There's a couple of ways this could be interpreted. Obviously, it's a very big gap. There's a few ways that I would interpret it to mean that those who are younger maybe might not have such experience when it comes to knowing what kind of substances they can take and what will be more detrimental to their health over others. So they're likely to be a little more, I don't want to say reckless, but they're more likely to take too much of a substance, not really knowing the potency over those above, compared to those above the age of 30. That being said, that's only one interpretation. It's possible that there's other reasons as to why this is the case. So if you have any insight on this, please feel free to let me know. I'm very interested in understanding how these trends might differ across age groups in terms of the more person-to-person perspective. Then, of course, because there is such a gap between overdose fatalities by sex, that I wanted to look at how these risk ratios differed by sex. So they vary over the years and they've shifted dramatically. As you can see, from 2014 to 2015, it went from females having a 25% increase, in fatality due to a substance, compared, and then dropped to 1% in the next year. So despite the higher counts of cases being among men, the proportion of overdoses among women ages 0 to 29 to all overdoses among women is high. So therefore, women ages 0 to 29 have an increased fatality risk due to substance overdoses compared to men. These can definitely be age adjusted, so that's something that the rates can be age adjusted, so that might contribute to, that might be able to control the, I'm trying to think of the word, sorry, the large degree of change in the risk ratios. So that's something that might need to be examined further just to get a better idea of what could be causing the noise behind these large variance in numbers. In addition to looking at substances by race and sex and age group, looking at opioid versus non-opioid is also pretty critical because overdoses due to opioids make up about 80% of overdoses here in the state. And that's on average from 2014 to 2019. And when we look at those by age group below the age of 30, we see a 4% increase in opioid overdose fatalities from 2014, but a 28% decrease from 2018. So that's something that I would think would be attributable to the fact that we've also noticed an increase in non-opioid overdoses. For example, there's been a really dramatic increase in methamphetamines and cocaine as a cause of overdose fatalities. So while the counts aren't nearly as high as what we see in opioid-based such as fentanyl or even heroin, it's, I think, critical that we start looking at these stimulant substances on the ground now, that way we can get in before they skyrocket. And that has already kind of happened, because if you look at non-opioids, there's been an over 200% increase in non-opioid overdose fatalities from 2014 and 150 increase from 2018. So I think from the city's Department of Health's perspective, something we really want to examine further is where cocaine and methamphetamines might be coming through in the city, as well as fentanyl, just to get an idea of what the process is like when it's coming through the state. And we've been collaborating with toxicology labs, with the medical examiner's office, and the local law enforcement to get an understanding of this further. That's definitely a work in progress, and I hope to have more information on that soon. This separates it out further, overdose fatalities among those below the age of 30 by substance type. So just reiterating what we looked at before, where opioids and non-opioids are both pretty, counts of non-opioids are lower in comparison to opioids. But there's definitely more overdoses due to opioids occurring between the among those between the ages of 20 to 29. And this is a shift. This is looking at 2018 to 2019. And as you can see from 2014 onwards, there's been an increase significant increase among those between the ages of 20 to 19, whereas the increase among those ages 10 to 19 has not been as dramatic, neither has it been among those below the age of 10. This separates the figure that we were speaking about by substance type even further. As I mentioned, fentanyl, cocaine, and methamphetamines are becoming substances that we're seeing quite frequently when it comes to overdose fatalities. There's been a 333% increase in overdose fatalities due to cocaine from both 2014 to 2019 and 2018 to 2019. And then an increase in 22, and a 950% increase in overdose deaths due to fentanyl from 2014 onwards. And this is just among those below the age of 30. The degree of change across all age groups is even larger. So fentanyl has definitely become an increasingly common substance. It's attributable for 75% of all substances here in the city. But while fentanyl has become more common, heroin has decreased. From 2014 to 2019, there's been an 8% decrease in overdoses due to heroin, and a 77% decrease from 2018 to 2019. So the four most common substances that we've been keeping an eye on have been cocaine, methamphetamines, fentanyl, and heroin. because they were the most common substances that we've been seeing. And as I've spoken about earlier, there's definitely been a really dramatic shift in the trends of those substances. And last year we were looking at it and it didn't seem to be as much, but this year we're noticing that as the trend has kind of completed itself with one more year additional data, there's definitely been a dramatic uptick that requires further examination. So the following figure represents non-fatal overdoses. As I mentioned, with COVID, non-fatal overdoses as well as fatal overdoses has become very important for us to look at. We've definitely noticed an increase in non-fatal overdoses as well as fatal overdoses comparing this time of year, January to September of 2020, comparing to January to September of 2019. And that's apparent in this non-fatal overdose data that was taken from EMS. EMS data does, EMS does a lot of data collection when it comes to how often they've gone out for a call due to a substance overdose, what type of substance it was, and how much Narcan was administered. Usually they quantify it as a heroin overdose. I don't know if that's just because EMS staff tends to just take off heroin, or they later ask the person, do you know what substance we're using? I don't think that's the case. I think they're just checking off a box. So it's possible that this data is kind of leaning towards heroin despite human error, but that's definitely something to keep in mind just when looking at this data. Non-fatal overdose, as I said, the figure below represents non-fatal overdoses from January to September of 2019 and 2020. And as you can see, across all age groups, almost all age groups, there has been an increase, particularly among those below the age of 20, which is, to me, what I found the most concerning. While those between the ages of 20 to 29 have not shifted dramatically, in fact, we're at the same count now as we were this time last year, there's been an increase in every other group, even among females, which statistically have had lower counts of non-fatal and fatal overdoses, regardless of age group. So keeping this in mind, when we look at substance type, as I mentioned, while heroin is the most common substance that's marked off, despite the very notable decrease in heroin over the years, there have been a larger number of overdoses, non-fatal overdoses that have taken place this year compared to last year. Same time frame, these two figures look at January to September of 2019 and 2020, and you can see that there's we've had over 200 more overdoses this year compared to this time last year. And heroin obviously is listed as the number one through EMS data, but it's unclear how specific that denotation is. That being said, it's still a markedly high count and still concerning. While there's no statistical significance between the two areas of data, there are still higher counts, and despite as I said earlier, despite the decrease in heroin-based fentanyl, the fatal overdoses, non-fatal overdoses due to heroin seems to have the highest frequency. In addition to heroin non-fatal overdoses being higher this year compared to last year, there's been an increase across all other categories as well, such as other opioids, synthetic narcotics, opium, and even methadone. I think some of the more concerned categories would be synthetic narcotics, and we have looked at how they classify. We're looking at how EMS classifies synthetic narcotics. You have a better idea of what the purity of those substances are, what's actually in those substances, and where they're coming from. This looks at non-fatal overdoses by age group. As I mentioned earlier, as you can see, heroin is most common among those ages 20 to 29. This is while we've had more overdoses overall, comparing this time of year to last year, there have been fewer overdoses in 2020 among those below the age of 30 compared to last year. I'm not sure what the cause of that difference is. It's by a margin of 57. So it's possible that that might shift over the next few days even. But I would like to think that maybe it's because those below the age of 30 are using other means of coping with the long self-isolation periods that we've been advised to do. But it's unclear if this trend will hold for the rest of the year. That's all I have. I did see a few questions, so I'm gonna see if any of those are something I can answer. Craig asked me what factors were included in the overdose risk score. So those are numbers that are just calculated based on odds ratios. It's not a calculation that's based on a multifactorial thing. It's mostly just looking at what the proportions are, comparing the proportions between all the other age groups. And the other, I think I also did by sex, so by sex as well. There were a lot of numbers. I hope I didn't throw anybody by that. If there are any other questions, please feel free to send them my way.
Thank you so much, Neha, for going through that. I think that last slide really was interesting in that, you know, we would think that rates would be going up, or like, you know, basically we would be looking at, or excuse me, because of like COVID and isolation, we would think that, but it's interesting that the data is showing not quite the opposite, but like less.
There's definitely been an increase over the years, but within the last 3 years or so, there's been a decrease across the younger age groups, which I think is really good to see on our behalf, but still there's a lot of work to be done.
Yeah, definitely would agree with that. Well, thank you so much, Neha. And if there are any other questions throughout the presentation that are more focused towards you, we'll definitely make sure that you have a way to answer that. Are you going to be able to stand for the rest of the presentation?
Yep.
Perfect. All right. Well, we will.
Sorry.
Yeah, thank you. We will move on to our next presenter. Unfortunately, she wasn't able to be here tonight, but she did pre-record her presentation. So we will go ahead and shift gears over to that. All right. So our next speaker is Susan Depue. She has a PhD from, let's see, I don't think she listed on here, but she has a PhD and she is a research assistant professor through the University of Missouri St. Louis and the Missouri Institute of Mental Health, or MIMH. Since 2016, Dr. Susan Depue has been working with both state and local organizations to improve the data infrastructure for increasing behavioral health across the state. Susan is the current project director for the Partnership for Success project and the Missouri Student Survey. She also sits on the Department of Mental Health State Epidemiological Outcomes Work Group. In these positions, she has worked to help Missouri stakeholders implement data-driven decision-making. So with that, we will go ahead and turn it over to Susan's pre-recording.
Hello, I'm Dr. Susan Depue, and today I'm going to be talking about the 2020 Missouri Student Survey. This is a survey that has been administered by the Department of Mental Health and the Department of Elementary Education every even year.
Sorry about that pausing.
Since 2000. We survey 6th through 12th grade students across Missouri. It is a two-stage design. That means that we do a convenience sample at the county level, taking pretty much everybody that we can get a hold of. That's going to be our focus today. However, we do the more rigorous random sample at a state level, and that will be available online. We're going to talk to them about that at the very end here if you'd like to access that. The participants that we're going to be talking today are the 6 counties that make up the eastern region, 7 counties. That covers 37 districts. And then we weight the data statistically to reflect the population distribution of the county. It's roughly equal male-female, a little higher female average, 5% Hispanic or Latino. We have about 23% African American and about 70% white. There are small percentages of other groups as well. So let's talk about the data. Best to start with past month use. What substances are youth using? Remember, this is 6th through 12th grade in the Eastern region. The primary substance that they use is electronic cigarettes, followed by alcohol and marijuana. Notice that the standard cigarettes are actually quite low right now. Looking over time, while e-cigarettes and alcohol are the highest rate, we do see a nice little drop from 2018 data, while marijuana, prescription drugs, and cigarettes have remained relatively stable. Pure substance use. We're going to talk today a lot about what their friends are doing. So notice with alcohol and marijuana, well, let's start here. Notice with all substances, the majority of students have 0 friends who use any of the drugs asked about. So nobody in their circle does it. However, with alcohol and marijuana, if they have a friend that used, it is most likely that they have 4 or more friends that are using. So a lot of people in their circles do it. Versus the other drugs we're going to talk about today, where if they're using, it's just 1 friend in their circle. Excuse me. So how wrong do they think it is to use drugs? You notice here that most students do think it is pretty wrong to use a drug. But if you look at the dark blue line, this says, how wrong would one of your friends feel if you used? And so consistently, they think their friends would feel like it was less wrong for them to use than they would feel about themselves, indicating a small amount of acceptance in the peer group that they don't really feel within themselves. Considering it pretty cool or very cool to use a substance, marijuana is considered to be the most cool substance out there. However, more than 1 in 4, or roughly 1 in 4, consider electronic cigarettes and alcohol to be cool as well. Only about 9%, 10% consider smoking standard cigarettes to be very cool. Again, we see that sort of very dramatic drop between the difference between the electronic cigarettes and the standard cigarettes. Standard cigarettes are on their way out. How much do they consider it a risk to use? Any alcohol use is considered to be the least risky. Notice that bars here indicate the higher they are, the less risky they are. Marijuana, again, about a third, don't consider it to be very risky. E-cigarettes are not very risky, but cigarettes and lately now prescription drugs are considered to be very risky. Looking at substance use availability. If kids are going to use, they're going to have to be able to get their hands on it, right? So again, the longer bars indicate that it is very, or at least sort of easy for the kids to get a hold of. Almost half consider to be alcohol and electronic cigarettes to be pretty easy to get. About a third for marijuana, and then it decreases from there. Interestingly, even with the other illegal drugs, which are things like heroin and methamphetamine and the things along that line, about 10% say that it would be easy for them to get. So where are they getting it? Alcohol. See, we talked about friends earlier. Notice that 55.6% are getting their alcohol from friends, followed by family members and taking it without permission. We're going to see that a lot as well. Notice that these numbers can add up to more than 100% because kids may be getting their stuff from more than one location. So again, the friend is the most. Cigarettes, the friend giving it to them is the most. Here, taking it without permission is second. And because cigarettes, both versions, are legal for kids to get, especially in those areas that have not passed Tobacco 21 legislation, buying them from the store is also pretty high on. Electronic cigarettes, the friends, and buying them from the store, overwhelmingly where they're getting their stuff. When we talk about electronic cigarettes, we have to think about the fact that this is a device, and the device can contain a variety of different substances. 81% approximately are using nicotine in their electronic cigarettes. However, about 50% are also using marijuana. Again, keeping in mind that kids can use more than one substance in a device, so this could add up to more than 100%. About a third of students, though, only use flavor-only products, which means there's no actual substances they're getting, but going back to that perception of it being cool to do, they maybe want to be seen to be vaping, even if they're not actually ingesting any products. Marijuana, again, the friend, almost 70% get marijuana from their friends. About half get it from the dealer. I guess a dealer isn't considered to be a friend. And then family members, about 22 or maybe a fourth of the students are getting it from a family member. Moving on to prescription drug misuse. When we're talking about prescription drug misuse, again, we have to think about, well, what particular substance are we doing? Most kids are not taking their mom's blood pressure medicine. But what we do see is that over half are taking pain medication not as prescribed. So that is the important part here, is that it is either not been prescribed to them at all, or they're taking it in a dosage or manner that was not as prescribed. So pain medication is 60%. A little less than a third are using sleeping medication, followed by stimulants and sedatives. And when you flip over to say, okay, kids, why are you using these substances? It actually matches up very nicely to the drugs they're using it. The majority of them are using it to reduce or manage pain or to help them sleep better. This is followed by more mood-altering things like helping them feel better or happier, or to help with stress. So how are they getting their drugs? Remember, previously, every time had been friends, but for prescription drugs, it flips it, and the family members are overwhelmingly the place where they're getting their prescription drugs. Okay, we're going to close this out. I mentioned earlier that we have some additional data available. So if you want to go cruising on your own and check out what we have, here are the websites. I'll pause for a second. The top website, the BHEW, the Behavioral Health Epidemiological Work Group, has a lot of pre-made products. So if you just want to dive in there and see what's available for your county, it's made for printing and passing out or sending out via email, very easy to use. If you want to do a deeper dive into the data, we have a data querying website which will let you pull out a variety of aggregate numbers from a variety of different sources. And if you'd like to talk to me, here's my contact information. We do have a listserv that regularly sends out data products around prevention of substance misuse, and mostly youth, but there are some adult things that come out occasionally. So if you'd like to sign up for that, just pop me an email and I'll get you on the line. Thanks a lot.
I did see that there was a question about this specific study. So this specific study is the Missouri Student Survey. I think, I don't know if it's listed. Yeah, right here. So it is, yes, the 2020 Missouri Student Survey. And I think she said it's conducted every year since 2000, and it's 6 to 12th graders across the state of Missouri. All right, and so with that, we will go ahead and move on to our final speaker of this evening. All right. So our final speaker of this evening is Shayna Parker. So Shayna is had a late start in her career, graduating from SLU in 2016 with her MSW. Shayna has been with Preferred Family Healthcare for 4 years and has served in 3 different roles, including youth and custody counselor, adolescent therapist for North County's outpatient program, and she's currently the family coordinator for the Youth and Family Tree Grant. Shayna is currently working to obtain her LCSW. As she said, she always thought that she would want to work with adults coming out of the prison systems, and once she started her journey with historically underserved adolescents, she never wanted to work with any other population. And so with that, I will go ahead and hand it over to Shayna Parker.
Thanks, John. Can everyone hear me okay? Yes, perfect. Lots of really, really good information. So I'm going to talk a little bit about substance misuse amongst adolescents and effective treatment. And I'm going to talk a little bit about the program I work on, as John says, because I'm on the ground doing a lot of that face-to-face work. So we'll go ahead and get started. So substance use trends that we've been noticing, vaping is really becoming a large trend amongst adolescents. According to the 2019 National Youth Tobacco Survey, the US is in an epidemic. As of last year, they had 5.3 million adolescents that were using some sort of vaping device, which could be filled with flavored juices, CBD oil, or THC. And we are seeing an influx of parents calling about treatment for vaping, not just for illegal street substances, however you want to say that. So marijuana, this is one of the ones I deal with mainly. I know that St. Louis has a lot going on with the opioid crisis right now. We see a lot on our program in Preferred Family with our adolescent treatment programs. We see a lot of marijuana. So the most common used drug among youth that we see is marijuana, which causes negative effects over time that are often difficult for users to discern. 43% of college students and 36% of high school students report frequent use. One of the statistics I saw also states that people who use marijuana prior to the age of 12 are twice as likely to experience a serious mental health illness as compared to those who first use marijuana at age 18 or older, because we all know the brain's still developing up into our 20s. So these are a little bit older statistics. I don't work, to be honest, I don't work in a lot of research-based. We have somebody that does our research for us. So I had to hunt for my statistics. Every day in 2018, 3,700 adolescents between ages 12 and 17 tried marijuana for the first time. Per day, 3,300 young adults, which are 18 to 25, initiated the use of marijuana. Teens are increasingly using marijuana through vaping as it is easier to transport and hide. And we are seeing a lot more of that in high schools. 9% of 8th graders, 16% of 10th graders, 14% of 12th graders, which is an increase, as you can see, like 7% and 7.5%, marking the largest increase recorded so far that I could find. So why is this trending amongst our youth? So a lot of the things we hear is to fit in. Young people do drugs because they want to be accepted. They want to fit in with their peer groups who are also doing drugs. And a lot of times marijuana and the vaping are some of the easier ones to get. To feel good, abused drugs can produce feelings of pleasure. They can, make what's the word I'm looking for? They can make any awkward situations feel less awkward. So to feel better, we have a lot of younger people who are a lot more younger people who are actually, where parents are actually seeing them present for mental health issues. It's not as stigmatized as it used to be, but a lot of them still don't understand, so that marijuana helps them feel better. Any different narcotic or drug, gives them that illusion of feeling better. To do better in academics or sports, we see that with stimulants a lot of times, steroids to improve their athletic performance, and to experiment. Young people often want to try new experiences, they want excitement. So what better way than with their friends at a party, out and about, to try something that alters the way they feel. Other things to talk about: how do you learn about substances and obtain them? And a lot of this is repeat information. I'm just saying a lot of what I'm seeing more in the work I'm doing. So in their homes, prescription medications, alcohol. With the youth that I tend to serve, a lot of parents have the marijuana present in the home. Online, you can buy almost anything online on the internet today. This was shocking to me, not shocking to me, but there are countless online pharmacies, which I knew, but they allow individuals to buy prescription medications that could otherwise never be obtained without a prescription from a doctor. And in many cases, the vendors are located in other countries, so it makes it a lot more difficult for them to be tracked and shut down. They're not, I mean, you click a box, are you 18 or older? Are you 21 or older? Yes. So youth are learning about and obtaining substances much easier now than back when I was an adolescent, that's for sure. Common misconceptions of substance use and treatment. So a lot of people believe, and adolescents believe, if you have a career, a family, you're doing well in school, you cannot be an addict. I can quit my addiction whenever I want. That's a lot of what we hear from the kids. Or I'm not addicted, I just smoke because it feels good. I haven't hit a quote unquote rock bottom, so I don't need treatment. Addiction is a choice that people make. People who are addicted to prescription drugs are different from people who are addicted to illegal drugs. And mind you, I am dealing on an adolescent basis, so I get a lot of, probably a lot more funnier responses than these, and uneducated responses. My child does not have access to drugs. Marijuana, vaping, alcohol, etc. is the gateway drug. We hear that a lot from parents. This is the gateway drug. We're beginning to realize that trauma really is the gateway drug. Any of these are just the solution for that trauma usually. So some other common misconceptions of substance use and treatment. This is mainly treatment. I must live somewhere other than my home for a certain amount of time. This is what I hear when kids are recommended into residential. I do not need to be educated on drugs and alcohol. I already know everything. Treatment only serves the substance use, not mental health. Treatment does not work. Treatment will work the first time, and treatment is too expensive. We hear a lot of these excuses, not only from our adolescents that we serve, but from our families, parents. So those are some of the barriers and the misconceptions, and one of the things TREE does is try to break through those barriers. I think that is it on my slides. So we're going to talk about a little bit about TREE and what TREE is. So TREE is a grant from SAMHSA that Preferred Family BHN received. I think it's been almost 2 years now that we've been working on this grant. So Treatment Enhancement and Expansion Project. So we are a referral program. We get referrals from hospitals, schools, family courts, medical offices, clinics, violence prevention projects. I've had a few come through through private practice therapists that I have worked with that work in school systems. We will take referrals any way they come to us, but these are our main referral forms. So my part personally, I work with St. Louis County Courts. Our TREE grant covers 4 counties. We cover St. Louis County, St. Louis City, Jefferson County, and St. Charles County. The way my referrals just kind of give you an example of how it comes in. An adolescent is out joyriding in a car that does not belong to him. He gets stopped by a police officer. He gets brought into detention. Detention screens these adolescents. So with the screening, they have to score 15 or higher to be considered detainable. And to score 15 is very difficult because one of the things we are trying to do in St. Louis is cut down on the cycle of incarceration or the school to prison pipeline. We're trying to prevent these things from happening. So detention will screen. Most of these adolescents will not screen high enough unless it is a violent crime. And they will ask the parents if they can give verbal consent to reach out to somebody to help them. Most of the parents say yes. I get a referral sheet from detention, and then I reach out to the parents and ask them, like, what is happening in your home? Do you think there's substance use? Do you think there's mental health? The beautiful thing with it is that TREE makes obtaining substance use treatment and mental health services absolutely free. So even if these families don't have insurance, our grant will cover the adolescent to go to treatment for as long as they need to. I have DJOs that reach out to me once they have an adolescent on their caseload. They may reach out to me and say, hey, I feel this adolescent needs substance use. Can you help me? We'll connect that way. There are 3 of us that work on this grant. One works in the Fox and Seckman School District. One works with the hospitals through BHN and the YERE program. And then myself, who works, like I said, in the detention centers, family courts, and a lot of the North County schools. One of the beauties of this also is we have a couple different residential sites, and if we have a client that is a city resident, they don't qualify for, let's say, the Children's Service Fund grant. Through TREE, they qualify for anything. We can get them in wherever. And TREE isn't just dedicated to preferred family health care. If we see that the adolescent is struggling with more than just substance use and needs mental health, although we offer adolescent psychiatry, we will also connect them to any provider that we feel is necessary. If that's ComTree, if it is, YRE, if it is Youth in Need, whoever it may be, we try to connect our families to what we see is going to be the best fit for them. So let's see how John had given me a little bit of an outline, and I'm kind of going down through it. So common reasons for relapse, or why it's hard for some of our adolescents to stick to treatment. So right now, and John touched a little bit on this, and I know that the webinar is going to cover this at later dates, but we're seeing an increase in violence. A lot of the adolescents we serve are in, they come from underserved areas where there are a lack of resources. They come from families who may have incarcerated family members, a lot of trauma. And when I say trauma, I mean anything from, they may live in an area where they hear gunshots all night. They may live in an area where they've seen somebody shot. They may know people that have been shot. So a lot of the youth that we serve have a lot of trauma. And when they come into treatment, they don't see the marijuana as a problem, and they don't understand that what they are experiencing is a trauma response. So, and a lot of it is complex trauma. So a lot of these youth come in with it in their head, I'll do this, but I'm not going to quit using, because that's not the problem, right? The problem is my environment. The problem is my peers. Or they come in court ordered and they don't see a need for it. There's just different reasons. A lot of time it's parental uninvolvement. We do see that's one of the barriers that I have faced a lot of. The adolescents are willing, but we don't always have willing participants in the family due to maybe they think lack of transportation, which we offer. So we cut that barrier down. Then it may be due to some legal stuff going on in the family they don't want us to be a part of. Again, although we're breaking through a lot of the mental health and substance use stigmas, they are still there, and they're very predominant in a lot of our underserved communities. So let's see, talk about relapse, why it's hard. So specific barriers to youth and families accessing substance use treatment. Again, a lot of families don't have insurance, and that is a big barrier. They don't have transportation. That's another barrier. We on the TREE project, we break through those by, again, it's a grant. They do not have to have insurance. It is also most of our sites with preferred family will offer transportation, and if they can't offer it, if it's a client I'm serving or a family I'm serving, I will offer that. Dawn will offer that. LA, the people that work on the project, we do what we can to make sure that those barriers are not there for our families. Why is the family systems model so crucial? So in order for our adolescents that we serve to recover and sustain recovery, or to at least get to a space of where they can function without the use of marijuana or vaping or alcohol or any other drug, we need the whole family involved in this. And 9 times out of 10, we all know that addiction, alcoholism is a family disease. It touches the lives of everybody. So one of the things that we do with Tree is we always try to connect our youth to substance treatment or counseling. Sometimes family solutions for kids is involved, but we always want the whole family to be a part of this. When the whole family is involved, we see that the healing doesn't just, come with the adolescent, it comes with everyone. All of our sites offer, so if an adolescent is connected to preferred family, they're always going to be connected. So once they have finished the program and they have gone on to do something else, 6 months later they relapse, we still consider them part of preferred. They can always come back. We offer them a team, so their team will consist of a community support specialist, which helps with school, job finding, peer groups if they need it. We offer them a drug counselor, an adolescent substance abuse or substance use counselor that works with them on finding out the reasons why they feel the need to use, to educate them about what this does to them. And we also offer them a therapist to deal with the mental health aspects. So that's one of the things I touched on in the slides. People don't think that substance use treatment covers the mental health all the time. We do offer therapeutic interventions, and we also have, like I said, an on-site adolescent psychiatrist who can help the families navigate prescriptions if that's what's needed, help them navigate cost of prescriptions, as long as they're a part of the program. So the family systems model is very crucial. We always, always, always try to set up that family therapy. Most families will usually agree to it. Now, the percentage that actually do it are a lot slimmer, but we're working hard to get that number up higher. So an example of an average case that I might have, so I get a referral from detention. That's where my main referrals come from. They send me a referral sheet. It has all the information, pertinent information about my client. They send that over to me. We say we have 72 hours to touch base with that family. I don't think any of us have ever waited 72 hours to touch base with a family unless it's a Friday night at midnight. Then we wait till Monday maybe, but we touch base with the family. We figure out the situation. We talk a little bit, and then we tell them what Tree is. We tell them what we offer and what we can do for them. Most of the time, the parents are at that point in crisis mode, so they want whatever help is available. We connect both parent and adolescent to an intake assessment at whichever. So we have South County location, we have a North County location, we have a South City location, and then we have a St. Charles location. And we have residential sites also in a couple of these different areas. So we will connect with an intake and assessment as soon as possible. We usually can get them in within 24 to 48 hours. We get the proper consent signed and paperwork signed, and they set up the treatment from there. I have had times where the barriers are very strong. It's usually parental barriers where they don't feel either A, their adolescent has a substance use problem, or B, they want their adolescent to go immediately to residential because this parent also immediately wanted them to be locked up in detention, and they don't understand that it doesn't work that way. So we do try to, again, with that family systems, while one of our sites is engaging the adolescent, I'm trying to engage the family more. We offer resources for the whole family, and that's the beauty of Tree. When an adolescent goes into substance use counseling, substance use treatment, a lot of times the focus is on the adolescent with the occasional family therapeutic interventions. I stay connected to the family. How are things going in the house? Is there anything I can do to help? What do you need? During COVID, we were, although we were mainly working from home, we were on the ground a lot, dropping off food supplies, dropping off whatever we could get our hands on as far as hand sanitizers, household items, that kind of stuff. In my realm, I did a lot of packets for families that were stuck at home. I did packets for kids that were locked up in detention. I did packets of all sorts of relaxation, art projects, all sorts of different things. So Tree is kind of one of those really amazing grants that we can cover a lot of stuff we have a broad reach, I guess is what I'm trying to say. I would like to share, I think I've touched on everything John asked. Yeah, I think I have. I would like to share, you know, a lot of people talk about the youth, the youth that I engage with. I engage predominantly in North County area, North City, some St. Louis City. I engage predominantly with adolescents of color, and there's a lot going on in the North County, North City area right now. And you know, with schools being shut down, and I know this happens everywhere, but it's been difficult for the schools to maintain contact with a lot of the adolescents I serve. And last year, or this past year when COVID hit, I had one more. I do hearings, what they call hearings in North County schools, especially in Normandy, and that's when an adolescent is caught with a vape, marijuana, sometimes even just a lighter. They're caught with any type of paraphernalia at school, they go through a hearing, and then the school decides what the discipline action will look like. If they get us involved and the parents agree to our program, the discipline actions are usually, most times, very minimal. Usually maybe a 1 or 2 day suspension, and then as long as they enroll in treatment, they can come back. So back in March, I did my last hearing before COVID. We had an adolescent that was a freshman in Normandy. He was caught with enough marijuana to be arrested for distribution and sales. But this is an adolescent that had never been in trouble before. The school was really, really pulling for this kid to do the right things, to get connected with us. And we connected him, but it was a very difficult process due to some family barriers. So we connected the adolescent. Technically, if he had done everything he was supposed to do, he probably would have been out of treatment by midsummer. He is still engaged with us. He has had a lot of difficulties, and like I said, the main barriers have been family. So I checked up on him the other day, because that is also part of my job. Even though I connect the adolescents to our sites, I still follow their progress. I follow progress even after they have been, graduated from the program, or whatever you want to say. I still check in with my families and make sure that they're, within, for 4 to 6 weeks, to make sure the adolescent's still doing well. So I checked in on this adolescent recently, and he was having a lot of barriers. He wasn't showing up for treatment. He couldn't get there. He wouldn't be available when they tried to do Zoom calls, just a lot of barriers. And come to find out, like I said, it was a lot of parental barriers. Well, the other day I saw that one of our North County counselors decided to take him to Normandy, pick up his Chromebook, set it up for him, make sure he had all his classes connected. And this adolescent today, almost 6 months later, now has a really good job, is connected to school finally and doing the right things, bought a cell phone on his own, has not used in, I think it's been 4 months now, maybe 5. He stopped using pretty quickly, but anyway, that is one of those stories that we look at what we're doing and we can say, wow, this grant is really working. I shared with John, if I can get 1 out of every 5 kids connected right now, that's a win for me, because as long as they get connected, the rest of the work kind of falls into place. It's really getting them connected and the barriers that are in front of all that. So I think I've touched on everything. I am grateful to be a part of this webinar and to have all the information that was given prior to sharing. John just put up my information there. That phone number is it's actually my work cell phone. If you guys ever have a youth 12 to 18 that you think could use our program, please feel free to reach out. I take calls from 8 a.m. till 5 p.m. And if not, you can leave a message and I promise I will get back to you probably within a couple hours, but we'll just say 24 hours to be safe. So thank you for letting me share about TREE.
Well, thank you for sharing, Shayna. That's great info to really know about, the observations that you see on the ground, but also, like you gave that case example of common, but also the very real barriers and the very real issues that you do face when they, start to engage in substance use treatment. And even the engaging can be very difficult too. So Yeah, thank you for sharing all that. And a lot of what you touched on, I think will be a good segue into next week's conversation around screening, early intervention, and identification of youth and their families that need substance use treatment. So thank you for sharing. With that, we will go on to our last slide, just about closing out, and just to provide you all with a little information, and then we can open it up to any questions that anybody has. So just as a reminder, next Wednesday at the exact same time, from 4 to 5:30, same link, however you got onto here, same way to get on to this episode. We will be talking about integrating substance use screenings into hospitals and primary healthcare settings. We have I believe 4 speakers that come from various avenues of this exact subject. So we'll have somebody that will be speaking about how to implement these kind of conversations in juvenile detention centers and working with DJOs. We'll be having somebody that will be coming from, 2 people that will be coming from St. Louis Children's Hospital that will be speaking about universal substance use screening within their entire hospital system. And then somebody that will be specifically talking about how on a like one-to-one or like them with some nursing staff, kind of how the implementation occurred and the trainings that they did to really get everybody set up. Then we will also have an individual that will be speaking from more primary health within like schools and within a bunch of youth serving organizations, and really how they are doing behavioral health screening and early intervention with their youth that they serve. So again, that is going to be a very great conversation next week, same time, same place. And I did want to just share 2 resources. The National Recovery Month, I want to share that just because it is National Recovery Month. We're talking about substance use, so I think it's very important just to highlight that. What is National Recovery Month? So every year there's a celebration celebration around this month around the gains that have been made by those in recovery, just as we celebrate improvements made by those who are managing other health conditions such as hypertension, diabetes, asthma, and even heart disease. And so sometimes behavioral health and recovery within substance use kind of gets overshadowed and not really thought about in the same type of realm as physical health. And so just to really highlight that, it's that month to celebrate those that are in recovery and constantly in recovery. So if you do know somebody that is, make sure to congratulate them and to let them know that their recovery is seen and that it can be a definitely difficult road. I also wanted to share through Behavioral Health Network, we do have a relatively new resource called the Show Me Hope Disaster Distress Helpline. It's been implemented for about 2 months now or so, but it will be going for the next few years. And so this disaster distress helpline is really for anybody that's been impacted by COVID and their mental health. So it doesn't have to be for individuals that have COVID. It's for anybody that has been, has anxiety, has depression, has any of these issues from being isolated at home, not being able to go to work, being furloughed, all of those issues that can occur and really impact behavioral health. And so this is a resource that anybody can call within the greater St. Louis area. You can either call that number that's listed there or text the Talk With Us to 66746, and you'll get connected to a community mental health center that will be able to help you really moving forward around more long-term services and care. And so with that, I just wanted to open up to any questions that anybody might have. I know that we still have our Facebook Live going, so we will definitely look at that, see if there are any questions. But does anybody on this call, on the Zoom, have any questions for any of the speakers? I will consult Facebook and see if there are any questions there. Give you all just another moment to gather if you did have a question. All right, does not look like we have any questions on Facebook. I guess nobody has any questions internally here, but kind of looking in your email over the next few days, I'll be sending out this entire presentation, the recording that Susan had done, and then the contact information for all of these individuals, along with these specific resources that I just shared with you. Oh, we did have a question. Is the tree service open in Franklin County? So since I do work on the tree grant, I can definitely answer that, though I think Shayna might maybe have a little bit more info, because I know there was some discussion about opening up to another county, but I know as of right now, Franklin County, I don't believe is included in the grant. But if you did have somebody that you needed to refer that was in Franklin County for substance use treatment, I know that Shayna and the other tree staff are very, very, very good about helping to identify other possible treatment avenues as well. So they can be referred. Doesn't necessarily mean that they would be eligible, but they can still be assisted. Shayna, is there anything that you would add to that?
Just like you said, we aren't open in Franklin County at this point in time, but always feel free to reach out, because we have pulled some strings here and there, and we do what we can to make sure the youth are getting connected somehow. So it doesn't hurt to send the referral.
Yeah, I guess if you wanted to, Teresa, specifically reach out to Shayna on her phone number that she had listed there, or you can always shoot me or her an email, and we can definitely help you out and get you connected. Were there any other questions about, for any of the speakers, or about tree, or anything related to substance use in St. Louis? You're very welcome. Well, with that, we'll go ahead and close out. Just wanted to say thank you for all of these wonderful speakers, Neha, Shayna, and Susan. Thank you so much for your expertise and sharing really about the work that you've been doing. I know I've learned a lot, even though this is the work that I work within, but I can always learn a lot more. So I can only assume that a lot of other individuals learned a lot from your sharing and your information. So thank you. And again, next week, same time, same place, we'll be talking about another great topic. And in the meantime, if you have any questions, feel free to reach out. Thank you all. Have a wonderful night.